clavicle, scapula, atlas, seventh thoracic vertebra, sternum, humerus, radius and ulna, hand, femur, tibia, fibula, Foot. Arthroscopy is a procedure used by physicians to view, sample, or repair tissue in a joint cavity. The physician makes a small incision in the skin and joint capsule to insert a small tube-like camera. This arthroscopy of the knee shows an examination of the lateral meniscus. Luxation or joint dislocation is the derangement of the bones that compose the joint. In these radiographs, the left shoulder is shown in both a dislocated, left, and normal, right, position. The arrow points to the head of the humerus in each image. These are radiographs of a fractured left femur before, left, and after, right, repair. This spiral fracture was repaired by the insertion of a rod into the medullary cavity of the femur. The rod is held in place by the screw visible in the radiograph on the right. Intervertebral discs of the spine are composed of a tough outer layer encasing an elastic central mass called the nucleus pulposus. Trauma or disease can cause the nucleus pulposus to herniate into the spinal canal. The herniated nucleus pulposus may put pressure in the spinal cord, causing pain and numbness. You may now roll over this sagittal cryosection containing a herniated disc. Within the skeleton are many freely moving joints that allow the bones to rotate or move back and forth within a certain range of motion. The knee joint is a good example of how bones articulate with each other to allow movement. The ends of these bones are covered with a smooth, tough material called cartilage. Cartilage reduces friction between the bones and acts as a protective cushion. Surrounding and lining the joint is the synovial membrane, a tissue that secretes a thick, slippery fluid. Synovial fluid acts as a lubricant within the joint. In arthritis, the tissues of the joint become inflamed and can deteriorate. The two most common forms of arthritis are rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is a disease that involves inflammation of the joint. The synovial membrane becomes inflamed and may damage the cartilage in the joint. Osteoarthritis most frequently occurs in the weight-bearing joints like the knee and hip. This form of arthritis is primarily due to the wear and tear on joints. Over time, the cartilage in the joints deteriorates, leaving the ends of the bones exposed and rough. Many of the soft tissue structures of the knee cannot be seen in radiographs. An alternative, non-invasive method of assessing a joint is by using magnetic resonance imaging, MRI. These images are MRI sagittal sections through a knee. Both bone and soft tissue can be seen in an MRI. In a cartilaginous joint, fibrous cartilage binds the articulating bones. These joints allow limited movement in response to twisting, compression, or stress. Intervertebral discs of the spine are an example of a cartilaginous joint. Articulating bones in fibrous joints are tightly bound by fibrous connective tissue. The sutures of the skull are an example of a fibrous joint. The human skeleton is divided into 4 classes based on shape: irregular bones, flat bones, short bones, and long bones. The femur is an example of a long bone. It is composed of both spongy and compact bone. You may now identify the parts of a long bone by clicking on the anatomy. Compact bone. Synovial joints are freely movable joints enclosed by joint capsules that contain synovial fluid. The knee is an example of a synovial joint. You may review the anatomy of a synovial joint by placing the cursor over the parts of the joint. In a hinge joint, the convex surface of one bone fits into the concave surface of another. Such a joint permits movement in only one plane. A ball and socket joint consists of one bone with a round head that articulates with the cup-shaped cavity of another part. Such a joint allows for movement in all planes, as well as rotational movement. The elbow is an example of a hinge joint. The elbow is capable of motion in only one plane: flexion and extension. The shoulder is an example of a ball and socket joint. The shoulder is capable of a full range of motion, including abduction and adduction, extension and flexion, and internal and external rotation. Condyloid joints are limited to movement in 2 directions. In a condyloid joint, an elliptical convex articular surface fits into a concave depression. The articulation between the metacarpal and the phalange is a condyloid joint. Gliding joints allow only side-to-side and back-and-forth motion. Articular surfaces can be nearly flat, or one may be slightly concave and the other slightly convex. The intercarpal joints are an example of gliding joints. Pivot joints are limited to rotation about a central axis. The articular surface of one bone is round and fits into a depression on another. The articulation between the atlas and axis is an example of a pivot joint. The saddle joint allows a wide range of motion. Each articular surface is concave in one direction and convex in the other. The articulation in the thumb between the first metacarpal and trapezium is a saddle joint. The adult skeleton consists of 206 individual bones arranged to form a strong, flexible body framework. The bones of the skeleton perform the mechanical functions of support and leverage for body movement. Various progenitor blood cells can be seen in this histological section of bone marrow. This histological image of compact bone is characteristic of the hard, dense outer portion of bone. This histological image contains elastic cartilage, which can be found in the earlobe, auditory canal, and the larynx. The epiphyseal disc or plate is the area of new bone formation in endochondral bones. Several zones of development can be identified. This histological image contains fibrocartilage, which can be found in the symphysis pubis, the meniscus of the knee, and in the intervertebral disc. This histological image contains hyaline cartilage, which can be found on the articular surface of bones, in the nose, and in the walls of respiratory passages. This histological image of spongy bone is characteristic of the inner portion of most bones. This histological image of a sagittal section from the knee joint of a rodent contains the major structures of a synovial joint. This histological image of spongy bone is characteristic of the inner portion of most bones.